I would like to introduce you the General Secretary of the 9th Congress of European Neurosurgeons, Dr. Guram Mjavanadze from Burdenko Neurosurgical Institute. Guram, you are the President, the General Secretary of this Congress. Would you tell us how could you manage to organize such a wonderful meeting?
Okay, first of all, I would like to say hello. My name is Guram Mjavanadze. I am from Burdenko Neurosurgical Institute, and I'm not the president, I'm secretary of this Congress. And it's organized because of, it was a great willing to have friends from all over the world, neurosurgeons from many countries. I have many friends here in Moscow on this very nice and very important event that we have here today.
Guram, would you tell us some words about yourself, your teachers, your way in neurosurgery? Why did you choose this specialty?
Why did I choose my specialty? It's now difficult to say in such a rush time. But it was when I finished my second school, my grandmother, she wished me I be a doctor. Because she says to me that if something will happen with you, Guram, and you will be in some, I don't know how to say,
imprisoned.
Some cold places of this country. You will always survive if you will be a doctor. And it's because my mother, she was also a doctor, and my father, he is a neurologist. And when I was a student of second year of the medical institute, I need to have a pocket money, and it was possible to be employed for Burdenko Neurosurgical Institute like a nurse. I don't know how to say in English. Like a sanitarian, yeah. And after that I started to grow there. I was a sanitarian. After that I was an operating nurse for a summertime. I was working in intensive care unit, and when I as a medium personnel, and when I graduate the medical institute, medical school, after that I asked the former director of this institute, Professor Arutyunov, to having me in this institute as a doctor. I want to be a neurosurgeon. And he approached me. We have in our institute also two years course for as you know very well, for preparing. We call it ordinatura. It's like
postgraduate studies.
As a not postgraduate, but as a residential time for 2 years in general surgery, in general neurosurgery, and after that 3 years in preparing theses in pediatric neurosurgery. And after that I became to be a pediatric neurosurgeon now.
So how did you choose the topic, the theme of your thesis? And why did you decide to specialize in pediatric neurosurgery, not in vascular or neurotraumatology, for example?
My thesis was the lateral ventricle tumors in children, and it was suggested by my teacher, Professor Ostotskaya. She says to me that this is very interesting, that here is very interesting problem how to manage this disease, and that Burdenko has nice experience in that, but nobody interested. It's very pity that our case reports will drop in history in time and nobody will summarize this. And it's because I fallen down in archive and find up there 95 case reports. I find there 67 And other patients, it's about 30 we operate in my department during 3 years. And it was really interesting one. To me to work, I don't know about
Yes,
physicists,
but why did you choose a pediatric neurosurgical department?
Choose pediatric department because it was a place there, and it was possible to work there, to occupy this place. It was vacation, vacancy there.
Vacancy, not vacation. Well, and well, I know that you invented some new approaches using ventriculoscopy, and the results were very interesting. So, can you explain why now these interesting approaches are not used?
Are not used in my institute?
Yes,
or
in our institute.
in entire world?
No, I am speaking of Burdenko Neurosurgical Institute.
Because for my understanding is that the keeper of knowledge is person.
Yes.
Keeper, and he is conductor also. And it's because of I am not involved now in endoscopy because I have another job, and only sometimes I use this endoscopy during a surgery, and it's just because I organized this congress.
Yes.
Only because that when I over this congress I will again
Well, but
I will start to use this because I like this method. It's I think interesting, and in this method I think would be a nice future if it's adjusting with jack laser with stereotactical holders and keepers and tuning together with jackets and nice tiny sucking tube, and I think it's possible to work. There is some problems with visuality because the temperature will high and albuminum will be denaturated, and it could be problem with understanding of where are you now after the bringing a laser beam there. But anyway, it's possible to rechange of artificial liquid this place, and it's possible to work. But it's the problem which is very interesting to deal with more than talk about.
Yes, well, I hope that after the Congress, you and your colleagues will continue this fascinating topic and obtain wonderful results. Guram, would you tell...
I'm sorry, it will be... I'm not sure that he must be some wonderful results. In some cases, in some how to say, it's endoscopy, this is the method of choice. This is not something that could treat everybody or everything.
Certainly.
For instance, you knew indications for that it's very interesting to understand, for instance, in third ventricle tumors, or with craniopharyngiomas, which is invaded through the bottom of the third ventricle, to understand just before the surgery, drilling a bar hole and put in the lateral ventricle in endoscopy, and you can understand what has happened with foramen of Monro. If the tumor is coming and blocking the foramen of Monro, and you can see that this is the bottom of the floor, or this is a tumor which is growing, and major part of this tumor is located in the third ventricle cavity. In this case, you can decide what kind of approach you will use.
Yes.
Via lateral ventricle, if they're empty, they're large enough, or foramen of Monro is nicely enlarged by tumor compression from below.
And to have a biopsy as well.
Or you can do a biopsy to understand what is it, and this biopsy is very soon will give you an answer. Is it the glial tumor, or this is a craniopharyngioma? Or you can go intrafornical, transcallosal intrafornical through this approach. I don't like this, but it's many surgeons use this. or you come with combined approach to the suprasellar region, the subfrontally, and together with interforaminal monitoral, interlateral. I like lateral ventricle, you know.
Yes. Well, we are joking that you are our Ministry of Foreign Affairs of the Institute. Would you tell some words about your activities in international relationships between neurosurgeons the world over and especially of Europe?
Thank you for your joke.
Yes.
In our institute, this is really only a joke.
Yes.
And I very appreciate this. But what about relationships? We have nice relationships, for instance, with United States, with Columbian University. We have a nice topic with a scientific topic with Bernstein, and we together agreed. Our Burdenko Neurosurgical Institute and Bernstein's clinic agreed about exchange of students and residents, and we are agreed to organize monotopical symposiums devoted the problems of deep-seated tumors and giant AVMs and arteriovenous malformations, and I think it would be nice because of people could communicate and they could be during the surgery together, which is very
Useful.
I think very useful for studying problem and to understand the common feeling about study they do together. But one problem is that our surgeons they can't operate in the United States, and particularly in New York, because all surgeons should be licensed there, and I knew this good because I was in Los Angeles a year and a half ago almost, and I worked together with Gordon McComb in his clinic. I visit Mike Appozo in USC, and I with pleasure remind this time.
Yes, I remember when we returned. You spoke a lot of your visit, and we were
it was really very nice.
Very pleased. And what is the difference between our and American neurosurgeons, in your opinion?
I want to finish that I knew from that the neurosurgeons licensed in California, for instance, he cannot go in New York and ask there about work. For him, it's necessary to approve his license again there. Am I right? That's true. Yeah.
Possibly.
Maybe it's good. I don't
Yes,
know.
but could you compare the neurosurgical level in our institute and in Los Angeles clinic?
Yes, of course I can.
Well, and
Why not?
what is the difference?
The difference is that the neurosurgeons in these institutions where I work for, they knew a lot of things, so they can do a lot of things. They has responsibility that I very like. You know, they has responsibility to manage a lot of different neurosurgical diseases, and they has the majority of people with whom I talk, according to my understanding, they has the approximately adequate level. It's impossible to say to everybody that everybody is brilliant or everybody is bad. It's variable, but majority of neurosurgeons, they has the nice standard. Nice standard, that means that the level of the neurosurgical care about patient organized very well, very good. And we have in our Burdenko Neurosurgical Institute, I think, nice thing that is maybe for patient could be also helpful. We have such a specialization of our neurosurgeon As you know, that
Yes.
our institute organized so that we have department where are collected people with meningioma of different types, meningioma in different
Yes, I
and
know this, but
vascular department and glial tumors department and basal skull tumors department. That gives a possibility to collect material in one hand and to be able to organize among these special labs which helps you in understanding this problem and having people who are groaning in your department and understanding this, and they are working with this and they have a nice common understanding. It's very important, I think.
yes, but don't you feel the danger of super specialization in neurosurgery that we have in our institute, when one man is operating on only acoustic neuromas, other operates on only hypophyseal tumors, whereas Western neurosurgeons are more wide and they try to operate all neurosurgical pathology. What is your opinion?
Yes, of course, but this is problem of organization, because I think that if it will be organized nicest way, it will be very nice if every year or every 2 years it will be circulation in our institute, or maybe 6 months or maybe 3 months. It's necessary only just to say how to think how to organize this nice way. And this circulation will involved only how to say, the 10 or 12 neurosurgeons, and they will be on the other places, and this will be such a rotation that it brings possibility groaning and finally we did this. When you was in residential time, you were circulating among...
Yes, but
all
after
our-
that, there is no
Yes,
such
and that's bad.
possibility to
Yes, and-
circulate.
Yes, I agree, and this is of course not good. This is not good. But this depends only from organization, from our director, the deputy of science, the deputy director of science, and others. In my pediatric, for instance, I would be very happy if my shift will be not moved. I want to have my team together. Only if for instance, among us four, we are 4 of us, only somebody whom I understand that for him is necessary now to go to the general neurosurgery and to educate a little bit there, and after that I want to have him here, because in pediatric there is a lot of special things which is necessary to be a pediatrician, to work with, and also it's very important to have a nice connection with general neurosurgery also, and it's because this is very flexible things, but this depends from organizer.
Well,
Major, the chief of department, she must be a very artistic person who can do this as he can, as he wants, as his understanding is how to manage his department.
what is your plans for the future?
My plans
Guram?
for the future?
Yes.
To be survivor of the Congress,
Well,
and to live almost, I think, I guess about 40 years, which is in front of me. I went
Yes.
together with my wife and my son.
well, I mean professional plans.
Professional
In
plans to
neurosurgery.
continue to be a neurosurgeon, pediatric neurosurgeon. I would like to say that it will be very nice if the communications between neurosurgeons and pediatric neurosurgeons will be improved, to communicate better way, to communicate faster way, and be closer together. This will be very nice. This is my things that I...
Would you tell us some words about your family, your hobbies?
We have time about that? How many
Yes,
times?
we have. For that question, we have time.
For that? About my family, I have my son. He's 14 years old. He was yesterday on this open year party, and he is doing well. He is tall guy. He played tennis. And
He will be a neurosurgeon.
He wanted to be a neurosurgeon because he likes this, this word. He don't know what does it mean, but this word he likes.
It sounds well.
Yeah, it sounds very good, and he likes my friends of mine who is accompanied my flat. They're very nice people, and of course they're very kind with him, and all of them are neurosurgeons or neurologists, and he thinks that if somebody is neurosurgeon or neurologist, they're a good man. It's because he wants to do it. My wife, she is Elena. She's name is Elena. She's beautiful. I very love her, and she's economist, and she's working at the university. And it's because together with her we are very happy when we talk about how to organize, how to manage, what's the price, how is possible, what's the way.
This is the source of your new ideas, yes?
It's very interesting. Our time in Soviet Union, that economy now became to be something real, not only some fantasy or some very old book that is not necessary to read. Now it's come something.
But what is hobbies?
My hobby?
Yes.
I like to play tennis.
Like Konovalov.
Like Konovalov. Yeah.
Are you playing together?
Very last half of year, practically not. It was not time to play tennis because too many efforts it took for preparing this Congress to organize things.
Well, Guram, when starting your endoscopy, were you influenced by the works of Dandy, Madsen, and other prominent American neurosurgeons who already performed this?
Oh yes, of course, because Dandy was first who put this urinoscopy. It was such an aluminum tube, 1 centimeter in diameter. And he put them into the ventricle of hydrocephalus patient for clipping choroid plexus, for stopping the overproducing of
cerebral spinal fluid.
Cerebral spinal fluid. After that endoscopy, it's an interesting thing that sometimes on the period in the early 30s, they again became, and after that again dropped in history. Nobody wanted to deal with. It's always, I think it's reflect the desire to see what is in there and to be savvy.
Yes.
And to be savvy. And it's because, of course, sometimes it's came, for instance, in the somewhere in 1984 and 1986 Fukushima in Acta Neurosurgica, Neurochirurgica, and in 1988 in Journal of Neurosurgery, he published very nice endoscopical articles.
Yes, there is
devoted endoscopy. But after that, he also left. I talked with Tako. Takanori Fukushima. He's a brilliant man. And he says that he was involved after that in another approach. He wanted on those time to use this for treating this seventh nerve palsy.
Yes.
And after that, he doing a very tiny bar hole, like 1 centimeter or maybe 8 millimeters, sometimes 6. He calculated by millimeters his trephination. And after that, he is able. He prepared. He elaborated his new instruments, which is very flexible and rig it together with that allows him to do many things in a very depth. And he says that, for instance, that as deeper for him is more space, because bar hole here is very tiny and small, but on a distance it's like a pyramid, and then he has some.
There is a fine Russian proverb that once to see, then 100 times to hear.
Yes, and he lost endoscopy because of his scientific interest changes a little bit.
Yes.
Because by saying you that for conducting some it is necessary to have a person who will deal with.
And what are your scientific interest, main interest, scientific interest?
My main scientific interest, I talked yesterday with Professor Selby, and I talked with him. It was very nice talking for me, for instance, at least. And I talked that my idea is, as it's possible to say, it's not my idea, but my interest is that bringing during the surgery much of those, technological development that we have around diagnostic, but pre-op and post-op period. But during the surgery, we are using finally only microscope and bipolar coagulation and CV forceps, nothing more. Something that we use, I don't want now occupy your time, but something that we use is not instrument which gives us understanding about a live brain, about metabolism, about relationships between tumor and glial cells, about that. And I think that efforts of mind, of clear mind, should be approached in a closer relationships with engineering, with engineers, with professionals from this specialty that now is, I think, goes parallel way. They could prepare, I don't know, nuclear bomb or something that can explode all this world, but when it's talk with them about how to manage the brain tumors, so how to help me please, I want to understand, is this little natrium goes out the membrane or it's over here. It's very difficult, and sometimes difficulties based on a language, because it's very, we talk in English or we talk in Russian, but there is language which communicate between professions.
Yes, and you are looking for the common language with the engineers to invent such devices.
Yes.
Well, and you are the only member of International Society of Pediatric Neurosurgery in the Soviet Union.
Me?
Yes. Is it possible that some other pediatric neurosurgeons could become the members of this society? What should we do for this?
A society of World Federation? Or
yes, there is
a member of
International Society of Pediatric Neurosurgery and European Society of Pediatric Neurosurgery. We have only one, it is you, representative. Well, is it possible that other pediatric neurosurgeon could join it, and what limits this?
There is no limitation. Limits only activity in a field of EANS and congresses and conferences, because people understand and knew you after your reports. When you are on a stage and you are talking and you show your slides, you show your material, you are honestly talk about your disadvantages, because as you know that this is more interesting to talk about, because of course the surgeons search predominantly successfully. Yes. And interesting to say why and how in this particular case you were unsuccessful.
Yes, I hope that after...
Just go and say.
Yes, I hope that after this Congress, more Soviet Union surgeons will have an opportunity to travel to visit these meetings and to present their materials, so they will be recognized the world over. Well, I must thank you for this brilliant organization of this symposium, for this interval, and I hope that in future the neurosurgeon and neurosurgeons in our country will be in very fine and good positions, thanks partly to this symposium.
Thank you very much for your warm words, but this is not my organization personally, because a lot of people from Burdenko Neurosurgical Institute and many other companies and many other people, we are working together. And for instance, you know well, this Muscovite stock association, stock company, which organized our cultural program, They work together with us. A lot of people who are really were involved from heart, you know, not because we paid money for them, but they want to do a job on a good level because they want to be proud of their work. And this is very important. Important was only one thing, to select these people. After that, these people working because of they like to have result which really will be nice.
Yes. Thank you very much.
Thank you very much for your opportunity.
Let me
giving
shake your hand.